Hi, everyone. Good afternoon. County Executive Pat Ryan here, and thank you for taking a few minutes from an absolutely beautiful, beautiful spring day to join us for our COVID and vaccination update. Try to keep it quick so you can get back outside if at all possible, even if just for a few minutes. At the high level right now, we are at really a critical inflection point with the two competing dynamics, one being trying to continue to lower the COVID infection rates, where we are finally seeing them at least plateau, if not come down a little bit from where they've been the last few weeks. And on the other side of that, trying to ramp up as quickly as possible our vaccination rates and numbers and percentages, which we are doing each week more and more and better and better. So as we're at this inflection point, before everyone is vaccinated to the point of herd immunity, and while we still have a serious threat of COVID, especially due to an increased number of COVID variants, it's absolutely critical that we all stay vigilant and stay engaged and make sure that we get through these next few critical weeks and hopefully come out the other side. By the numbers in terms of the entire course of the pandemic, now well over a year, we've had 13,514 cases, administered over 327,000 tests, had 11,525 individuals recover, and unfortunately continue to see, although slowing numbers of fatalities, continuing to see fatalities. 246 Ulster County residents now have succumbed to COVID-19. Looking at the hospitalizations, those have remained flat now for the last really over a month, going on a month and a half. We are currently at 11 hospitalized in the county, 2 of them in ICU beds on ventilators. That is about steady, but slightly up from where it was about a month ago, and definitely higher than we would like. And once again, until we can get that new positive infection rate down and the total active cases down, we will continue to see folks hospitalized and folks passing from COVID. Active case numbers, some small reason for encouragement here. We had seen, of course, the second wave and the spike there in January and into early February. Then we saw the numbers really start to come down, but they have been leveling off and even slightly increasing for the last 2 weeks. Today, we did finally see the active case count, start to slowly tick down. We're at 1,743 active cases right now. As a reminder, that is still significantly higher than even the peak of the first wave a year ago, but it is at least holding flat at that plateau, and we have more work to do to really get those down over the next those active cases down over the next week or 2 or 3. And again, back to why we're seeing that active case count high, you can see it on the next chart, which is our number of new daily positives that we're getting every single day. This still remains much higher than it should be and can be before we can really get out of the pandemic and start to ease additional restrictions. In the last 96 hours since our previous update, we are at a 4.73% new positive rate. That's averaged over a 96-hour period, 4.73%. We've tested in that 96 hours 5,308, 5,308, and had 251 new positives from among those tested. That 4.73% is, again, slightly coming down from where it was a week or 2 ago when we were at 7, 8, or even 9%. So that is some reason for encouragement, but we need to get that number back down to 1% or even below 1% like we were in the summer of 2020 when things were under much better control. As we see the vaccination numbers go up, we can anticipate that the new positive cases will go down. But as I said at the beginning, we're still at this critical inflection point where we're a little less than 40% of county residents vaccinated. And so that means we're about halfway to herd immunity. And so we still have several more weeks to go before we're at that point. Hospitalization capacity numbers, we remain and have been in good shape here for many months. You can see the current numbers at 11 and more than sufficient need in the medium and long term in terms of hospital and treatment capacity. Unfortunately, even with the nice weather, even with some reason for hope, and even with a year plus of the pandemic behind us, it is still essential and arguably even more critical with the increased COVID variants that we continue to follow precautions so that in this next 4, 6, 8 weeks, while we're ramping up vaccines, we keep the new positive rates in check. So that means continuing to wear masks. That means continuing to maintain social distancing and avoid gatherings, and continue to wash hands and use hand sanitizer, all the things that we took very, very seriously a year ago and that we really still have to continue to take seriously until, once again, we get the sort of all clear from the public health officials in terms of COVID infection rates and herd immunity dynamics. Switching gears to our vaccination progress. Progress continues, and actually today, April 6th, we reached another major milestone in New York State, where now every single resident of the state and, of course, of our county who is 16 years of age or older, every single person 16 plus is now eligible, regardless of any other health conditions or job requirements or anything like that. If you are 16 years or older, you are now fully eligible for the vaccine beginning today. And that is very positive news, because it now means that the eligibility window is open, and it just comes down to how quickly can we get supply from the federal and state government, and then do our piece here at the county and local level and really get shots out into arms as quickly as we possibly can. And those numbers are ramping up week after week. So this is a really positive development on that front. And to match the increased eligibility, we are seeing more vaccines coming to us. And in fact, this week in Ulster County, we're receiving a record high number of vaccines. Our total allocation this week for the county and all of our partners is 7,700 vaccines, 7,700 vaccines. If you remember back to even just a month or two ago, that is 10 to 20 times what we were getting just a month or two ago. So we're making really good headway with the supply, and I want to thank our leaders at the federal level and the president, our leaders at the state, the governor, all working together to get the supply really flowing to everybody here on the ground. In addition to the 7,700 that the county and our partners are getting, providers and hospitals and so on, we also continue to have the New York State-run vaccination site operating at the Ulster County Fairgrounds. This week, they will administer just under 6,000 shots. So between all of the county efforts, the state efforts, our other providers and partners and pharmacies will be administering a total in the county of 13,550 doses this week among everybody. At that rate, with just some rough math, that means we've got another 2 to 3 months at most, even at the current supply rate, 2 to 3 more months at most before everyone who's eligible could be vaccinated. So that is, again, much, much faster than our worst case projections assumed several months ago when the supply was really trickling in. Now that we're getting that faucet opened, as Dr. Tack says, we're seeing the supply come quicker and we're distributing it, and really proud of the progress that we're all making as a team, getting this vaccine out and saving lives as we do it. So please, if you are 16 years of age or older and you haven't been vaccinated yet, please get that done, not just for yourself and your family, but everyone in the community benefits when you are vaccinated, and we know that the risks are very low, and so it is the right thing to do and the smart thing to do. Our vaccination locations this week include our now multi-week standing county pod at the Hudson Valley Mall at the former Best Buy. You can see our other partners listed there between hospitals, other medical practices, and pharmacies. And so I want to thank all those folks who are continuing to do that work as part of our vaccine distribution coalition. We have a lot more shots to get out there, which you'll see in a second here on the slide. But the work that we've done to get to the numbers we're at is really, really remarkable. To put up our progress as a county, I'll put up the numbers here. We've now crossed the threshold where over 70,000 Ulster County residents have at least received their first dose. Well over 40,000, 42,000 plus have received both their first and their second dose, putting us at just shy of 40% of our population now with their first vaccine, 39.4%. And once again, with the supply flowing as it is at around 14 to 15,000 per week, and with another 85,000 people left to be vaccinated, that means even at the current supply, if everyone is willing to get vaccinated and does their piece there and able, then in 2 months or a little bit more, we could be through the rest of our residents in the county, which would be phenomenal and probably the single most impactful thing we can do to get through the end of this pandemic. So what can each of you do out there in terms of yourself and spreading the word to make sure that everybody gets vaccinated? It's much easier now because, again, none of those conditions or am I eligible or any of those things are necessary. If you're 16 or older, you are eligible. All you need to do now is actually go to our Ulster County page. It's vaccinateulster.com. Because there's no more questions about eligibility, we are now going to just directly post the actual sign-up links right on that page. So every day you can just go there and check. You'll be able to see, okay, April 8th, there's a clinic. I'll click on that and I'll just book my appointment right from there. So we had previously had this pre-registration list, but now because everyone is eligible, we're just making it much simpler and more streamlined. You can just go to vaccinateulster.com, click on that link and get one of those appointments. It'll be 1 week at a time because we're not able to book out because we don't know how much we're going to be getting each week, at least at this point. But for right now, you can go on there. There are hundreds of appointments remaining as of, I just checked right before this briefing. So there were 600 or 700 on Thursday, 600 or 700 on Friday, which are the days we'll be doing our pods this week. So please go get signed up for that and share those links widely. Please feel free to share those links. At this point, we just need to get as many people vaccinated as possible and do the work, each of us, to really get to those folks that might have barriers to the vaccine, whether that's transportation or internet access or other barriers. That's a lot of the work that our team is going to do with our vaccine distribution coalition. One of the big pieces that I'm announcing today to make that easier and to recognize that now with everyone eligible, we have even more work to do to get people vaccinated. I've directed that UCAT, our county transit operation, which also operates in the city of Kingston, will provide free rides at no cost for anyone in the county who's going to be vaccinated. You can get on that UCAT bus and get to any of those sites that the county is running, and that will be at no cost. So transportation should not and will not be a barrier for getting your vaccine. In particular, for those seniors or those with disabilities who might need sort of door-to-door, curb-to-curb service, you can, as was the case before, you can call our UCAT 24 hours in advance of your appointment and actually schedule that, and we'll be able to come bring you door-to-door. That's for those 65-plus seniors and those with disabilities to make sure that, once again, transit is not a limiting factor. On the screen is the number, or was the number, maybe we can put it up again, the number to call our Ulster County Area Transit. That's 845-334-8120. Give them a call again 24 hours in advance, and that's another way that we in the county are doing everything that we can to remove the barriers to getting vaccine. Cost shouldn't be a factor, transit shouldn't be a factor, and disabilities or other barriers. We're going to do everything we can to remove those and get people vaccinated as quickly as we possibly can. The last request that I have, if you've already been vaccinated and you want to help in this effort to get everybody else vaccinated, the remaining 60% or so of the county we have left, please consider signing up as a volunteer or worker at our vaccination sites, at our pod site. It's both rewarding in terms of getting to see people receive, hundreds or thousands of people receive this life-saving vaccine, and we are providing a stipend pay for both medical volunteers and non-medical volunteers. So whether you're a doctor or nurse or previously were and have that medical experience, or you just want to help, we have roles for everybody and anybody. And again, you will receive a stipend for that. So please go to ulstercountyny.gov/volunteer and you can sign up there. And chip in even just one shift. It's a really, really positive and impactful way to be of service to your community at this critical time. And I know everyone that works there says that they walk out tired, but feeling better about lots of things, better about our community, better about the progress we're making towards eliminating this virus. So on that note, I want to thank everybody that's all been doing their part to get us through this, all of our frontline workers who continue to put themselves at risk to keep our economy running, keep our society and community running. I want to thank all of our volunteers and workers at our pod sites and our vaccination sites, all of our other partners, pharmacy workers, healthcare workers that are doing their part, our public transit workers that are now going to be shuttling our residents to those appointments, everybody chipping in and getting us through this. So thank you to each of you. Thank you to everybody tuning in and spreading the word about what's happening. As always, if you have any questions or needs related to COVID or otherwise, you can call our Recovery Service Center, which is the one-stop shop for help. That number is 845-443-8888. You can also go on our COVID-19 page. And once again, just one more reminder, please share. If there's one link I'd ask you to share, it's the vaccinateulster.com page. That is where you can go to sign up or to get that link and send it around to friends. If you've already had your vaccine, please send an email or a text to 4 or 5 or 40 or 50 friends in your network, in your circle, and say, please, if you haven't been vaccinated, please do it. And now there are appointments, and eligibility is not a limiting factor. Transportation is not a limiting factor. So we're getting there. We're making progress. As spring starts to really sort of blossom around us, there are lots of reasons to be positive and encouraged and kind of feel good in hopefully the final stretch here of getting out of the pandemic. So we will see you at our next update in 48 hours on Thursday at 3 p.m. In the meantime, stay safe and healthy and resilient, and we'll see you soon.